If you've been diagnosed with aortic stenosis, you might be wondering if heart valve replacement is right for you. It depends on your individual health, but understanding what your cardiologist looks for in your tests and symptoms, and how surgery can impact your long-term heart health can help guide the decision. Options for treatment include surgical aortic valve replacement, SAVR, or TAVR, transcatheter aortic valve replacement. Doctors use 3 basic criteria to decide whether to recommend heart valve replacement. The first is severity. They determine this by running tests to see just how narrow your aortic valve is. Stenosis is considered severe if your aortic valve area is less than 1 squared centimeter. The second is impact, whether it's affecting your heart. When your aortic valve is tighter than it's supposed to be, it impairs your blood flow. To keep you healthy, your heart picks up the slack. Over time, the added strain can cause permanent damage to the muscle. Your provider looks at a measurement called left ventricle ejection fraction, or LVEF, to see how hard your heart is straining to pump blood throughout your body. An LVEF score under 50% usually means it's time to think about surgery. If you have a normal LVEF, your doctor may determine you need an aortic heart valve replacement based on laboratory tests, abnormal results on a stress test, or how fast the stenosis is progressing. Finally, your doctor will consider your symptoms if you have any. Over time, all the extra effort that your heart puts in can cause it to get larger and stiffer. Those changes make it harder for your heart to pump blood the way it should. Symptoms like shortness of breath, chest pain, fatigue, dizziness, and fainting are signs that your heart is struggling to keep up with the demands being placed on it. The more severe your symptoms are, the clearer the sign that it's time for heart valve replacement surgery. If it's not treated, aortic stenosis can lead to heart failure and early death. Heart valve replacement with surgery or TAVR can stop heart damage from getting worse and give you welcome relief from uncomfortable symptoms. It's important to know that aortic stenosis doesn't always cause symptoms right away, but that doesn't mean that the condition isn't putting serious strain on your heart. So you may need treatment before you start having any symptoms at all. When you're deciding whether to have heart valve replacement, it's important to focus on your long-term health, not just how you feel right now. So ask your provider if and when treatment with surgery or TAVR might make sense for you. Getting the timing right can help protect your heart, relieve your symptoms, and improve your quality of life.